these fractures distract you from the life threats. You can get there and your patient will look so screwed up. I'm not talking about head injuries, all right? Head injuries, we're gonna have to worry about. I'm talking about the extremities. What's up, Freddie? You wanna share it? So, remember these fractures we're gonna have to worry about. We're not gonna necessarily worry about, all right? Okay? Remember the state question. Don't let obvious deformities or fractures distract you from the life threats. You can get there and the person's leg is missing. All right? You control that bleeding, it's no longer a life threat. All right? Now you have to worry about anything otherwise. Patient being unconscious. Patient not being able to breathe. Patient developing tension pneumothorax because they fractured their rib. All right? Things like that you have to worry about.
What if you do everything and the patient like still bleeds?
Did you put a tourniquet on?
Yeah, you do everything.
So what are you supposed to do if they keep bleeding and you put a tourniquet on?
Keep him more pressure. I'm just transporting him.
That's not what I told you guys.
Oh, apply more pressure, what you said?
Because you're going to transport and you're just going to be sitting there like, hey, you bleeding, sir?
No.
Plastic
You
bag.
have to fix the tourniquet?
No. That doesn't take that
Plastic
to do.
bag.
If I put a tourniquet on someone's extremity and they continue to bleed, what am I supposed to do? It's already tight.
You already have it.
You did one already.
You took the bag and put it on.
Transport.
We already said transport. Now we transporting. What are you going to do on the way?
Hey, how you doing?
Nah,
Put it
Direct pressure.
that's
Well,
not
I
the
decided-
fuse. What do you do after that?
Psychological first aid.
It's fine.
Guys, you need another tourniquet.
Oh.
Oh! Put another tourniquet on it. All right? Put a tourniquet above that tourniquet. Remember, a tourniquet is supposed to be where?
2 inches.
2 inches above the site. All right? Once you put that tourniquet on, if that tourniquet don't stop the bleeding, you probably didn't apply it correctly. Because anytime you put a tourniquet on properly, it's going to hurt worse than the wound itself. Because you're taking everything, all their blood vessels and nerves, and you're crushing it against their bone to stop all circulation. All right? So that nerve is going to be firing off like, yo, a train is sitting on your leg. A train is sitting on your arm. So they're going to start yelling when you put that tourniquet on. You know the tourniquet is on properly when you see what? Bleeding stop. That's how you know it's on properly. I don't care how much they scream. I want my patients to scream. All right? That means they're alive. That means they still with us. All right? Let them scream. Let them keep screaming. They're still alive. All right? So if in fact it continues to bleed, then you put a tourniquet above that tourniquet. Do you ever put a tourniquet on the joint?
No.
No. All right? So if the tourniquet is distal to the elbow and it continues to bleed, then you need to put the tourniquet proximal to the elbow. All right above it. So obviously with open wounds, you always want to brush away any debris. You don't want to, you need to control that bleeding before you start to splint. So you're going to start splinting the area, but you're going to control the bleeding. So if I have an open fracture and it's bleeding, control the bleeding first, and then you're going to dress it with a splint. And whenever we do soft tissue injury management, you never want to put a pressure dressing on top of something that's already dirty. If you see chunks of dirt and mud in this person's wound, and then you put a dressing on top of it, all you're doing is helping to seal a fate with infection. All right, take the sterile water, wash it real quick. Unless it's a life-threatening injury, and if you don't stop it right then and there, the person will die. You have to be alive in order to fight infection. All right, so keep that in mind. So we already know what the golden hour is. So explain it to me. I know. That's me, Roger. You got see? Bam, bam. Like that, right? Golden hour. Go ahead, Dwayne.
Like the time of the injury.
Two.
The hospital or when you treat it.
No. Jasmine.
Sorry to interrupt. Do me a favor. When you pick, stand up, say your name, and talk loud, okay?
Yes, sir.
All right?
Yes,
sir.
Jasmine. Jasmine, from
Okay.
the time of the injury to the time that they're getting definitive care.
Good. So from the time of the injuries to the time they get definitive care. All right. So not just any help. All right. They need the right help. Okay. We have a patient suffering trauma. What do this patient need? They need a trauma team, right? Or maybe they need a trauma surgeon. Okay. So if they're bleeding out and nothing can stop that internal bleeding but a trauma surgeon, we're not definitive care. The emergency room isn't definitive care. That operating room is definitive care. All right? So it's from the time of the injury until the time they receive definitive care. Very difficult to do in an urban environment. All right? Around here, you might be okay. Maybe. You might be okay. All right? But in other areas, you have to really be careful about. Okay? So, like it says, always look at the big picture. All right? The big picture is this person was hit by a truck and they fractured their pelvis and their femur. Maybe, just maybe, all right, they have a significant amount of injuries throughout the rest of their body. All right? So you definitely have to look at something like that. Okay? So we definitely going to have to pay attention to that. So scene size up always. Then do your MOI. All right, make sure your scene size up is good, and then use your standard precautions as necessary. Try to find out if you need additional resources. You guys already know significant MOI versus a non-significant MOI. All right, so you have to pay attention to that as well. I'm gonna put like almost every single one of those criteria on your module exam. So make sure you know it. All right, and every single one is significant MOI on your module exam. So make sure you guys know all your criteria for that. All right. Manage your ABCs. Then you got your high.